Good morning, everyone. Thanks for joining us. I'm Erin MacPherson. Joining me today, I have Laura Clary from GBMC. Good morning, Laura. How are you today?
Good morning. I'm good, thank you.
Thank you so much for taking the time to talk with us. So we are talking today about the GBMC event happening next month, the Walk a Mile event to benefit SAFE and DV program at GBMC. Can you tell me exactly what SAFE and the domestic violence program is at GBMC?
Sure. So SAFE stands for Sexual Assault Forensic Examination and Domestic Violence Program. So what we do is we care for patients in the community that come in seeking treatment for sexual assault, child sexual abuse, human trafficking, and intimate partner violence or domestic violence.
Why is it so important to offer these services and have that available at GBMC?
It's really important for these patients to have somewhere safe to go. We provide the service. It's very specialized service. So we have certified forensic nurse examiners and victim advocates that are available 24/7, 365 days a year to respond into the hospital whenever a patient presents that would need this specific service.
And I know I went into the hospital before COVID and actually got to see the facilities and specifically what you had to offer for the children to make them feel comfortable. So can you talk to me just about exactly what that space entails?
So we were really lucky that our hospital leadership and some philanthropic donors supported our cause. And we actually got a brand new safe suite for patients coming in seeking this type of treatment. It's very spa-like healing feeling when you get into the unit. It is still very secure and locked so that patients feel safe when they're in there as well. But basically, this space was created so that we can provide the best care and treatment possible for these patients come in after a traumatic event. And we have 2 examination rooms, and one is specifically set up for children. So even coming down to the paint colors and the artwork in the room, we wanted to create some place that kids felt safe, that our child life specialists could come in and work with these children and their families during such an unfortunate event.
What about the services? So we've kind of dove in a little bit to what exactly the program is, but is this something where someone comes there initially for an examination and then, stays in that program for a while to help them throughout that process? What is the services offered? What are the services offered?
So most of our patients are outpatient, so they come in specifically for medical forensic treatment. So we provide medical forensic exams, which entail a basic head-to-toe nursing assessment, photographing any injuries that we would see, as well as collecting any kind of biological evidence that would link back to the crime that happened. Most of our patients do not require admission within the hospital. So we provide everything right there in our safe suite. We collaborate with our emergency department providers to ensure that these patients are receiving the necessary medical treatment that they would need. And then we provide advocacy services as well, which is really important. And that advocate comes in, works alongside the forensic nurse, and they provide, emotional grounding and crisis counseling. And then they really serve as that link to our community partners to ensure that when these patients leave our facility, that they have somewhere to go to follow up with for long-term counseling.
Now, you mentioned the community partners. You talked about advocates and also if there's a crime. So what are the other agencies that you work with in the community?
So we work very closely with our Baltimore County Police Department, specifically the Special Victims Unit, as well as the Crimes Against Children Unit. We work with our Child Advocacy Center, which houses DSS and Child Protective Services. And we work very closely with Turnaround, who is our local service provider for long-term advocacy and crisis counseling for victims of domestic violence, sexual assault, and human trafficking. And then we work really closely with our state's attorney's office as well. So we like to say that we really take a multidisciplinary approach to caring for these patients because we know that their treatment and their care are going to go well beyond just the walls of GBMC.
So there are a lot of pieces to helping these patients. How has COVID impacted that relationship and even just people being able to come in to the facility?
So we've said since COVID hit, I mean, we never expected something like this, but we know that these crimes don't stop even in the middle of a pandemic. So it was really important for us to make sure that we maintained our 24/7 coverage, making sure that patients coming in still had that face-to-face interaction with our advocates, with our forensic nurses. And then we developed some different workflow changes so that patients coming in could bypass the ER and come straight to the safe unit. Anybody that had the unfortunate, had to visit a hospital, unfortunately, during COVID, especially in the beginning, could see how scary it was going in through the emergency department and seeing the tents that were set up outside. And that's not just at GBMC, but it was hospitals across the entire country. And we knew our patients were still needing our services, but they were afraid to come into the hospital and potentially be exposed. So we needed to figure out a way that we could make our services readily available, and that patients felt safe coming in and seeking treatment.
So typically, do your patients just come in? Do they call? How does that process work?
So we get patients a couple different ways. So some come in through the emergency department, typically with a friend or family member. We get a lot of patients brought in by law enforcement. So they've initiated the investigation on the front end of things, and then they get brought in with law enforcement. And typically in those cases, they get brought straight to the safe unit. We also have transfers from other neighboring hospitals that when a patient presents to their ER, they have to have a way to get them to us within a reasonable amount of time. And then we get referrals from, again, Turnaround and other community partners who have patients connecting with them, who then they send to us for additional treatment.
And is this facility, this option for people in this community, is it unique to this hospital, to this area? Is it common to have in other places?
So we are the Baltimore County Safe Center. So we provide, we are the only hospital in all of Baltimore County that provides sexual assault forensic examination services. Typically across the state of Maryland, each jurisdiction has their own Safe Center that is responsible for covering that area. So we are the designated Safe Center for Baltimore County. But what I will say is that we see patients from all over the region, and just because their assault happened in a different jurisdiction does not mean that we won't treat them here. So we never turn patients away when they come in to seek treatment.
How can people in the community help?
So I say we are a true nonprofit. None of our patients ever receive a bill for the medical forensic services that they receive when they come in. They never receive a bill for anything that we provide to them when they need to leave. For example, we provide getaway bags with clothing and toiletries. We provide teddy bears and books and other things, just a lot of comfort items that we sometimes take for granted. So if anyone's looking to help, we certainly can take, donations of those types of things. But we also have an event called Walk a Mile in Their Shoes in April, and it is our big annual fundraising event as well as our awareness event. So participating in that, it would be huge to help us.
Now, before we get to a little more details about the event, you mentioned donations. Are you still accepting actual physical donations with COVID going on, or is it just monetary?
So we accept monetary donations, but we also do accept physical donations as long as everything is new. So everything has to be brand new and completely closed. So we cannot accept any kind of used clothing, used teddy bears, used anything anymore.
Okay, so definitely keep that in mind. So talking about the event, the actual event is April 17th. Because of everything going on, of course, it is going to be virtual. But from my understanding, we're actually starting technically on April 1st. So we have some time to get our steps in. Can you talk to me about how the event is actually working this year?
So, so we actually start on April 1st. Unfortunately, we would love to all be able to come together and walk arm in arm for this cause, but, we had to figure out a way to make this still safe and people could still participate. And we've had a really good response actually with our virtual walk a mile last year. So what you do is you can go out with your family, with your little group, your dogs, anything, and basically just walk a mile or even more. And then you go to the Walk a Mile website and you log in how many miles you walked, basically in awareness and in support for victims of sexual violence and domestic violence and child abuse.
And to help spread that awareness, do you want people to post it on social media, hashtag anything? What should they be doing?
Absolutely. So post away on social media. When you see things about the event, please share them to get the word out. Tell your family, tell your friends. It's a really great way to raise funds for our program because we, again, are completely supported through, donations and grants. And but more importantly, I feel like just the awareness that, these unfortunate crimes happen right here in our community. It's unfortunate that our services are needed as often as they are. So really spreading awareness about, and letting people know that they're not alone. It's really powerful when you see people all out in support for these victims who at some point really feel very alone.
Do you have a set goal financially, or how many people get involved? Any type of goal for the event this year?
So we have a goal for the amount of miles that we would like to see logged in, which is 2,891 miles logged in from people walking. So I know it's it's a steep goal, but I know we met it last year. We exceeded our goal last year. So we're hoping to exceed that goal again this year.
And I believe that there's something significant about that number for the goal.
I believe it is the amount of patients that we have treated over the last 5 years.
I mean, and I think just hearing that number of how many people have really been affected by this definitely will touch people and make them realize this is happening. We're seeing that, and it's great to have, a facility in our community to be able to assist these people.
Right, exactly. And again, the fact that we are always available, we never close our door to anybody, even in the middle of a pandemic.
Now, is there anything that you wanted to let the community know, anything that you think I missed that you wanted to discuss?
No, just again, awareness is key. Spreading awareness about this service, getting the word out that we are still available and that will always be available for patients. Spreading awareness through word of mouth, but again, really sharing it. Social media is huge right now, especially with everybody, being stuck in the home and utilizing technology more. So really spread awareness about this program, about this fundraising event on your social media platforms would be super appreciated.
So that's our biggest challenge for everyone right now, is just to walk from April 1st till April 17th, as many miles as you can, but not just getting out and moving, but really posting on social media and letting people know why you're walking, what you're doing, and just to inform the community about everything that's going on right now and how they can help.
Right.
Perfect. Well, everyone needs to head over to our website, WMAR2news.com. We have a link there to GBMC's website for the Walk a Mile event and just for more information about this particular program that they offer. So we definitely want everyone to do that. Again, it is April 1st to April 17th, but the actual event, right, Laura, is the 17th, that Saturday. So should people just walk those entire 2 weeks, or just that one day?
No, I would walk, the entire 2 weeks, log in your miles, upload pictures of yourself and your little group walking. I know personally, I like to walk with my dog. So I'll be logging in pictures of me and my red Converse walking with my lab. So anything that you can do just to, spread that awareness and share those photos.
Perfect. And I'll be walking with my dog as well, which I'll love to get those extra steps in for those couple of weeks for sure. But so again, the challenge for everyone, walk April 1st, April 17th, and just make sure to post on social media so we can continue to spread the word. We have more information on our website, WMAR2news.com, and also on GBMC.org. Thank you so much for joining us, Laura.
Thank you so much for having me.
Bye, everyone.